Bismillahirrahmanirrahim. We were discussing the subject of acute suppurative otitis media, and we have discussed in that acute suppurative otitis media is the infection of middle ear cleft by pus-forming organisms. Now let's discuss the clinical stages and signs of acute suppurative otitis media. When the infection occurs clinically, how it looks like, there is first stage of tubal occlusion. The first stage is stage of tubal occlusion. When there is obstruction in the eustachian tube because of inflammation, obviously the air in the middle ear cavity, which is already present, is utilized and mild negative pressure is created, which is responsible for a retraction of the tympanic membrane. So in early stage of tubal occlusion, when infection occurs, mild negative pressure in the middle ear cavity is responsible for a retraction of the tympanic membrane and mild inflammation of the tympanic membrane. That is what happens in the stage of tubal occlusion. It is at this stage when the patient may feel uneasiness and feeling of some blockade in the ear. The next stage is the stage of pre-suppuration. Now when the infection continues and before pus formation, the stage of pre-suppuration occurs, where there is increasing swelling in the middle ear cavity. The tympanic membrane will show you the blood vessels running on its surface. Dilated blood vessels may be visible, and there will be mild congestion of the tympanic membrane, which goes on increasing. The redness of the tympanic membrane is there with exudates, which is present in the middle ear cavity. To start with, it is serous exudate, and later on it will be converted into mucopus and pus. In this stage of pre-suppuration, the patient will feel mild conductive deafness, which he will complain of, and the pain might start in the ear. Initially it is mild pain. When the stage of suppuration, the next stage comes within a few days, there is excessive redness of the tympanic membrane, and excessive swelling is also responsible for bulging of the tympanic membrane because of collection of now fluid, pussy fluid in the middle ear cavity. And this goes on increasing in quantity. Ultimately, when the pus is formed, the patient will have now moderately severe to severe pain and conductive deafness, definite clear-cut conductive deafness and pain in the ear. This is the stage at which the patient will feel real pain, which goes on increasing until there is perforation of the drum. Patient will also have temperature at this stage. Temperature initially might be mild, but at this stage patient will have moderately high temperature, maybe 102, 103, 104. Again, this temperature is more in children as compared to adults because of low resistance. And then on the tympanic membrane, a yellowish area starts forming. Yellowish discoloration appears on one spot of tympanic membrane, and at this yellowish area, ultimately the tympanic membrane bursts open. Some of the books, they also call it a nipple stage. Then there is stage of resolution. Once there is perforation in the tympanic membrane and discharge, mucopurulent or purulent, starts coming out through the external auditory meatus, the pain starts decreasing and inflammation also becomes less, and the conductive deafness which the patient was feeling, that also decreases in its intensity. And the next stage is stage of resolution, that is the tympanic membrane, ultimately the perforation in the tympanic membrane will start healing and it will come back to its normal position and discharge will stop if the infection is well controlled and the patient's resistance is good. The investigation which we can perform in these cases, that is complete blood examination indicative of acute infection, which you already know, increased polymorphs and increased WBC count. X-ray chest is a routine baseline investigation which may not be that beneficial in this condition, but pus for culture and sensitivity, that can be a good test for proper treatment of this condition. The pus which comes out, if it is sent for culture and sensitivity to know exactly the causative agent and also its sensitivity to antibiotics, that will be of help to us. Now that is the stage in a normal person, 4 stages: stage of pre-suppuration, stage of suppuration, stage of nipple formation, and ultimately resolution stage. They occur in majority of the cases automatically. But in certain situations where the resistance of the patient is low or the treatment given to the patient is insufficient or delayed or incorrect treatment, in that situation the patient may not get this stage of resolution early and may enter into certain complications, certain problems. We will just discuss the treatment in this case and we'll talk about these things. The sequelae of this suppurative otitis media in the middle ear can be the persistent sterile middle ear effusion, that is secretory otitis media. We have already discussed that in cases of unresolved cases of suppurative otitis media can ultimately enter in the condition of otitis media with effusion or glue ear. Patient can have adhesive otitis media, that is excessive adhesions formation between the tympanic membrane and the medial wall of middle ear cavity. Patient can have excessive scarring of the tympanic membrane, and ultimately patient can have persistent perforation in the tympanic membrane, the condition entering into chronic suppurative otitis media. These 4 sequelae can occur in these cases if the treatment is incomplete or improper. Now the treatment. Obviously, it is infection by pus forming organisms, so we will require to give the patient antibiotics. If the culture and sensitivity report is there, then antibiotics should be given accordingly. But before that, we can start antibiotic according to our own experience. which are effective against this type of infection. The antibiotics can be given orally as well as by injectable form, but while giving antibiotics, we should be careful to give the antibiotic in proper dosage and for proper duration of time, and also keeping in mind the organism responsible for causation of the condition, whether the antibiotic is effective against those organisms or not. Improper use of antibiotics can result in certain sequelae which we have just discussed. Analgesics combat pain and inflammation. We can give the patient analgesics. Most of the time given orally, the analgesics, they are sufficient to combat the pain of the patient and also to decrease inflammation. Antipyretics, most of the analgesics, they are antipyretics also, like paracetamol, like ibuprofen, or drugs like that. But this thing is very important, that the antibiotics must be given for proper length of time. And in this condition, I would like to say minimum 1 week therapy with antibiotic is needed, or it may be a little bit more prolonged according to the patient's condition. The role of surgery. As we have talked about the 4 stages of acute suppurative otitis media, in the 3rd stage, which was the nipple stage, in which perforation occurs in the tympanic membrane. But in certain cases, if this perforation is not occurring in time, it is more and more delayed because of very tough tympanic membrane, and the patient's condition go on deteriorating. He is having more and more pain, temperature goes on increasing, deafness goes on increasing, and in spite of use of antibiotics for more than 72 hours, the patient is not responding and the discharge is not coming out. In that situation, the surgery can help, and we can do MYRINGOTOME, that is giving a nick in the tympanic membrane so that the pus can evacuate out quickly and the healing starts. So the only role of surgery at this stage is MYRINGOTOME, to evacuate the pus and to facilitate the process of healing. Now, apart from this treatment, the treatment of associated conditions in the upper respiratory tracts should also be considered, which we have already discussed, which are predisposing factors for infection in the middle ear. And if some complication occurs, we can treat the complication accordingly. Thank you. A photograph, acute suppurative otitis media stage of pre-suppuration. You can see there is redness of the tympanic membrane, and the blood vessels, a few blood vessels are visible on its surface. And this is the acute stage of suppuration, full suppuration, with collection of pus behind an intact tympanic membrane. And you can see very clearly the tympanic membrane is bulging out, with excessive redness of the tympanic membrane and dilatation of blood vessels. That is MYRINGOTOME. MYRINGOTOME is a specially made knife by which you can give a nick in the tympanic membrane, a small incision in the tympanic membrane under anesthesia, and evacuate the pus. So have a look on this MYRINGOTOME. the end of this myringotome is sharp knife-like, and that is the tympanic membrane. And you can see just in front of the cone of light a line which is showing you the incision line, myringotomy. Now this incision can be given in the anteroinferior segment of the tympanic membrane or in the posterior segment of the tympanic membrane. But while giving this incision, we should be careful not to reach the margin of tympanic membrane. We should remain short of margin so that healing can occur easily. And mind it, the surgical incision in sterile conditions heals much better than a perforation otherwise. So this myringotomy incision will heal easily after the pus is evacuated, and we continue treatment for a few days afterwards. The results will be good and the patient will have almost normal middle ear again.